I think there's a bigger emphasis that needs to happen on educating about disease conditions before starting to talk about a brand. Address some of the needs that these communities have in terms of education, raising awareness, and understanding what happens. What could potentially happen if you don't take care of the underlying conditions that you may be facing, a loved one is facing, a child is facing, or even a parent? So that's important as a millennial generation because we are like helping our kids, our parents, a sick spouse, and lastly ourselves. So we also have to deal with the stresses and mental health that comes along with that. And so I think there needs to be a bigger drive and empathy around awareness and creating resources that really are more accessible, more culture driven, having that understanding. And also, a large part is that the data is missing because there's a lack of Hispanic or Latino in clinical studies. Hopefully, that's going to change in a few years. We are starting to see that because it's now becoming part of a regulation by the FDA to have more participation by other ethnicities in those types of clinical studies. But I think there's so many parties involved with the need to educate and build awareness to the Hispanic community that it really needs to be more spoken about.